Thank you for that update.
All right, hey, we're checking out a new way to turn back the hands of time. It's an injection that instantly plumps your face, fills in those fine lines. So
we're talking about an instant here. And so, of course, we sent Chris and Anderson to go out and check this out. You're going to have to make believers out of us because we're going, does this thing really work?
Well, I was excited to check it out myself because Demi Moore, Madonna, Sandra Bullock, like all these celebrities, Kim Kardashian, are rumored to be using this liquid facelift. I know there's an official name, but it's called the liquid facelift, you know, popularly. And so I have Pat Foley here, registered nurse, who's going to tell us all about it. So the big question is, does it really work? Tell us about it.
Oh, absolutely. So Voluma is made by Allergan and actually is made for specifically mid-face volume loss. And a lot of people, especially in Scottsdale where we're very lean, lose that mid-face volume loss, and they lose that lateral cheek that comes with that nice triangular shaped face that is very youthful. So what we're doing today is we're restoring some of that for Miss Debbie here.
Okay, so we have our gorgeous model Debbie here. And explain the markings. You've started on one side of Debbie's face, right?
Absolutely. So these are called Hinder's lines, and they actually help compartmentalize the areas of injection. So traditionally we're going to start laterally here, which is going to lift the jowl area, which everybody loves. And what's unique about Voluma is that it actually holds the tissue up. So it lifts, not just fills. So think of Voluma as a tack gun and Juvederm or any other HA as basically spackle. It's filling a wrinkle, but this is actually going to lift and hold this tissue up for Debbie.
Okay, so you've already made a couple injections, and now what are you going to do?
So I'm going to go into the anterior medial portion here that's going to lift here. And you can see that when I do that, by just lifting here, it helps with the nasolabial folds, and it helps with her marionettes. Also addresses these lines in the tear trough. So these are all aging factors that we don't like. So by injecting here, okay. Debbie, I'm going to have you turn here. I'm just going to gently go in here and put a little bit of filler in here, and that's going to help lift those areas.
And I know this is after using a topical numbing cream, so this is virtually painless, am I right?
Yes, Debbie doesn't feel any of this at all. This is very, very comfortable for her. No. So what I want to do is I'm going to take these marks off, and I want you to compare the one side that we've done, her left, with her right, and see the subtle differences, but it's a very youthful look.
And the thing about this is it happens instantly, so we're able to show you on live TV.
Absolutely. Everybody loves instantaneous results. It looks very pretty. It doesn't look done. Nobody's going to know that Debbie had anything done, which is very important in my profession. Yeah. I want everybody to be, you know, looking good, but not done. So that's very important to me. So Debbie looks nice. She looks rejuvenated, but not overdone.
How much does this cost, and how long does it last?
That's the other good thing about Voluma is it lasts up to 2 years, wow. Which is awesome. Yeah. It is a bit more pricey, okay. But it's worth it in the long run. When you think about the longevity, it's well worth it. Prices vary throughout the valley, so you just have to kind of call your practitioner and kind of go from there.
Okay, is there a range? Anytime you hear celebrity, you're like, is it $5,000?
No, you're probably looking at between $8,000 and $1,000.
Okay, for 2 years, wow.
That's pretty good.
That is pretty good.
That is very, very good. So you can see that, you know, she doesn't have any pain, no bruising, no marks on her, very easy to do.
I know with Botox, you have to get it done every few months. So 2 years, I mean, that's kind of a sticking point.
That's a big plus.
Yeah, no pun intended with my sticking point.
That's exactly right.
But anyway, well, thank you so much, Pat. Thank you, Debbie. We really appreciate you sharing this with us. Okay, ladies, back to you. I can totally tell a difference. So to answer your question, does it work?
Yeah.
I'd say yeah.
I can totally tell. And it didn't look like it hurt her at all. She didn't flinch or anything. It was pretty painless.
Yeah.
No,
instant cheekbone.
The topical numbing, yeah.
Yeah, she's beautiful to begin with. So tell her
Thank you, Kristen.
I agree. That's what I told her.
She's already looking great. What a gorgeous face she has.
There she is.